Welcome back, everyone, to the third session of the Maine AEP School Health Series in partnership with the Maine Department of Education. We are excited to have Erin Frazier here to present on school nursing and the provision of services to students with disabilities. Like last time, can everyone please ensure that your name on your Zoom is your first and last name so I can make sure you get your credits when I pull the participation list? And if you're just joining us, please introduce yourself in the chat for, your first and last name, where you're coming from, whether it be a school or a practice. So Erin Frazier began her job as Director of Special Services Birth to 22 in Maine in 2019. Prior to her role as State Director, Erin served as a Special Education Administrator, Principal of a Public Special Purpose Program, an IEP Coordinator, a Special Educator, and a Paraprofessional in a Special Purpose Private School. Erin believes the best part of leading special education in Maine is the capacity to support changes statewide, including increasing resources in underserved communities, providing engaging professional development and training, and coordinating with general education initiatives to promote equity, innovation, and inclusion in Maine. So thank you for being here, Erin, and I'm going to hand it right over to you.
Thank you, everyone. It's really great to be here. I just want to provide a little bit of a warning. I have a kitten that is feeling especially rambunctious right now. So if you see me kind of swatting around my head area, that's my kitten trying to, I think she maybe has taken a break, but just in case I do that, well, thank you for having me. This is a really exciting, I get a lot of questions from directors, from school nurses. I work closely with Emily Poland, Tammy Diaz on the provision of services for students with disabilities in the state of Maine. And as you know, I'm the Director of Special Services, Birth to 22 in Maine. That includes Child Development Services. I was the interim state director of Child Development Services for a year. I just gave over that position, which is really great. So today, the learning objectives really are to understand the laws that you have to have an understanding of in the provision of services to individuals with disabilities. I especially want to review with you the FERPA, Family Education Rights and Privacy Act. What is that as compared to HIPAA? What are my rights as a school nurse? What kind of information do I have access to? What shouldn't I have access to? I really want you to understand your role in the IEP process and where your services might show up on an IEP, and also just apply any of these principles to your practice. It'll give you a greater understanding of kind of how these things work in a school setting. And please feel free to ask any questions along the way. I'm going to kind of go through these slides a little quickly because I want to leave a little bit of time at the end of this presentation to answer any questions, specific questions you may have. So these laws, IDEA, Individuals with Disabilities Education Act, is the federal law. It was reauthorized in 2004, and during it has been in an act, it's going to be 50 years next year. So 1975 is when IDEA, and it was again, a lot different, but it was really the understanding that people with disabilities have rights in our society that they should have access to. It was reauthorized in 2004, and that was to include the word that you might hear in school settings called least restrictive environment, meaning at that point, they wanted to make sure that kids had the most access to general education programming possible. So that's why that was reauthorized. Now in Maine, we also have a MUSER, Maine Unified Special Educations. You'll hear that a lot. You're mentioned in that rule. That is our state rule. And that is everything in addition to the federal law that we need in Maine to be able to make sure that children with disabilities have access to the supports they need. And federal law trumps state rule, but many things in Maine are unique to Maine, such as we have communities without schools. So this chapter 101 is just to kind of clarify for folks how Maine might have additional needs beyond IDEA. Our main law that we work with in IDEA is FERPA, the Family Education Rights to Privacy Act. I'm going to go through that with you a little bit more extensively in a couple slides. And then there is a massive law called 504, which is the Rehabilitation Act of 1973. 504 and IDEA are both under the Americans with Disabilities Act. 504, however, is a much larger law than IDEA. 504 actually if the accommodations are followed on a 504, it is the only federal law that supports people with disabilities where people can sue for money. So if a teacher does not provide an accommodation, you can get individually or personally sued under this law. In IDEA, the only mechanism for legal remedy is through the school system. I always told my teachers, if you don't agree with that accommodation, do it anyway, because you are liable as a person who's discriminating against someone with a disability. The differences between these two laws, one is the need for specially designed instruction. That's the only difference. Oh, sorry, there's another difference. You have to have an adverse effect. The disability must have an adverse effect on your ability to access your general education. So a child with that diabetes, for instance, would probably may have a 504 plan with accommodations around being able to eat whenever they want to, or being able to go to the nurse if they're feeling unwell, or have a specific health plan that would be in a 504 plan. That those accommodations might be enough to support a child in accessing their educational environment. Diabetes can be significant enough to have an adverse effect on the educational setting, and that would be a child who potentially misses a lot of school. But that need for specially designed instruction is really the differentiation between those two laws. And you have a role in both of them. You have a role in both these laws, and they can both happen concurrently. So you can have an IEP plan and a 504 plan at the same time. So the implementation of the IEPs, the difference is an IEP has to be overseen by someone who is highly qualified in special education. So someone who has a certification in special education, high incidence or low incidence disabilities, teacher of the deaf, teacher of the visually impaired, et cetera. We also have a birth to five special education certification. So those folks have to be certified in order to oversee an IEP. In a 504 plan, there's no such responsibility. Your SAU will just direct somebody to be responsible for it. Oftentimes it's a school administrator. Sometimes it's a special ed teacher, although it is a general education law. It is not funded and it is not enforced at the Department of Education on my team because when people have complaints about 504, they go to the Office of Civil Rights, not to the Maine Department of Education. So there's no kind of responsibility. A lot of times special ed folks are connected with 504s because who has knowledge in your district about differences and health conditions, and usually your special education staff. Who gets a copy? Parents, students, teachers, school administrators, counselors, nurses, and bus drivers. Now, when I say who gets a copy, these copies would be copies of the accommodations. The health teacher, the bus drivers, the cafeteria workers will not get all aspects of your IEP. They won't get your goals or your your evaluation, but you will get the accommodations that it's necessary for this child to have in order to access your program. And where are they implemented? 504 IEPs are implemented in classrooms, hallways, cafeterias, everywhere, bus, field trips, school assemblies. Also, 504 plan, same thing. Every place in your educational setting. And if you go on a field trip, that's considered an educational setting if it's during the school days and all children are supposed to access yours. So that's considered the school day. Um, and I will say that that's kind of sometimes hard for people to understand how they have to extend school to that. But you cannot discriminate and prevent children from, or students from going on those experiences because they have special education needs. And I always like to say everyone is important in implementing these plans, everyone in a school setting. If a student has a significant food allergy, you're going to have specific staff all over the building that are going to know about that in case they see a response that they have to. And that would require a health plan or a crisis plan, an emergency that you would be a part of developing along with potentially the child or student's healthcare provider. So, what is FERPA? Um, FERPA is the Family Education Rights to Privacy Act. It was passed in 1984, and it's basically the right to see information that the institution is keeping on a student. Who has the right to see it? Only specific people, right? So that is the law that says it's the school's version of HIPAA. Think about it that way. This is an educational record. Not everybody has access to certain parts of the record. Some people have access to certain parts of the record. Um, but parents have the right to see this information that's kept and maintained by the school. They also have a right to seek an amendment and to those records, and in certain cases, make a change in that record. They have a right to consent or disclose those records. So in order for us to get Maine Care reimbursed, we have to consent to release those records to Maine Care so that they can authorize Maine Care services. And you have a right, there's a right to file a complaint with the Family Policy Office. So this is the FERPA. FERPA is the HIPAA. You have two laws that you're dealing with, FERPA and HIPAA. If all your IEP data and records should be kept separate from the cumulative file. And sometimes this doesn't happen, but it is supposed to happen that way. The IEP records are supposed to be in a double locked cabinet, and they're supposed to have a list of who has access to those students and who has access to those records. And you may be on that list, but those IEP records generally wouldn't be kept in your office or with health records necessarily. So, um, but remember, FERPA, just like HIPAA, is around educational records. So these records are directly related to the student and they're maintained by the educational agency. So that's important to understand because if you have records that are in your sole possession, that are used as memory aids, that are notes for your use to be able to do your job, those are not accessible records to other people. And it's important to know that as a nurse, you have records that families can't access if they're personal records to you. And when someone subpoenas you or FOAs for your records, those personal records are exempt from that in most cases. Also, you would follow your attorney's advice and not mine. But personal records are really for a sole possession of record. So we call the referral to special education child find, and it is our duty to do child find in the areas where we live, and that is to make sure that if anyone suspects a child of having a disability, that they can have the appropriate health, vision, hearing, social, emotional intelligence test to understand whether or not there is a disability that exists. The evaluations have to be trained by knowledgeable people in their field. I cannot do a health assessment of a child where you can. I do not have a license to do that. I have a license to do an achievement evaluation. So that is the evaluation of academic needs. Um, and you also have to have a multiple evaluations. You have to have evaluations in multiple areas of suspected disability. We have 13 disabilities that we recognize in Maine. Not all states have the same recognized disabilities. These are probably they're pretty commonly known: specific learning disability, autism, other health impairment. Um, you can read this list. I won't read it to you. The the um, the disability that you may mostly be involved in. Of course, you have orthopedic impairment, multiple disabilities. Those are students with sometimes high medical needs. But obviously, traumatic brain injury might be someone you're brought in to consult on, and also other health impairment. And why other health impairment? Other health impairment, they cover these conditions. ADHD is the majority of children in Maine under other health impairment are children with ADHD. When you do a 504 plan for ADHD, you make that 504 plan, by the way, this is not well known, although I do try to say it wherever I can, whenever I have a captive audience. You have to write that plan without, as if the child did not have the amelioration of the medicine. So, in other words, the ADHD plan often is what happens to a child, what kinds of accommodations they get in an event where they forget to take their medicine, right? ADHD medication is typically fast acting. If it's not on board, people notice. And so that would be a conversation that you'd have in your 504 development. Also, epilepsy, long term illnesses, epilepsy, anxiety, often under OHI, health disorders, Tourette syndrome, heart condition, leukemia, long COVID has recently been recognized as a long term health condition for kids, lead poisoning and asthma. Those are types of, but I just want to make sure that you know that having a condition does not mean that you automatically get special education. It could mean that you need accommodations from a 504, but remember that this condition would have to interfere with your ability to access your regular education program in order to rise to the need for an IEP. So that is basically in Maine, our biggest categorization for students in Maine is specific learning disability, followed by other health impairment, followed by speech language impairment, followed by autism. So we have a high incidence of autism in the state, and we're currently working with, there's a lot of work that we're doing with the University of Rochester on fetal alcohol syndrome disorders and looking at the prevalence of autism and FASD as being something that mimic each other's symptomatology sometimes. So there's a lot of work being done that I'm bringing in experts to kind of help people understand some of the subtle differences between those two disorders. FASD is a brain injury, and we don't have currently a specific categorization for that. It could fall under many of these conditions. Maine is it's a top two contenders for the most identified state in the nation. We are in the top five, but we vie for New York. We go back and forth with New York. We have about 20% of the children in Maine who are identified in special education. And that is noteworthy because it means that a significant amount of our population is potentially not accessing their general education environment like they should be. The required IEP team members, oh, I'll also say about special education, and this is national, but in Maine, 64% of children identified are boys, 36 are girls. So we have a disparity between gender as well. Also, there's a lot of disparity between race, ethnicity, and multilingual status. Required IEP team members are these four people: the parent or guardian, the general education teacher, special education teacher, and administrator. Also recommended is a person with knowledge of the child, and also recommended is the student themselves. So, but they are not required team members. And even though as a nurse, you're not a required team member, there's a lot of reason for you to be at an IEP team meeting where you're discussing health needs. So depending on the place where you work, they're going to be really good at inviting and including you. And sometimes our school nurses are left out of that process for many reasons, but it's not best practice because obviously you have certain expertise that you can bring to the table when you're working on these plans comprehensively. And you have information that not other people in the team have. Um, so your role is really a subject area expert. You have a medical understanding, obviously medical training. You understand complex medications. You understand complex medical conditions and how they interface and how you must interact with them. There's oftentimes that You are working with a student who might have a trach tube. You might have a crisis plan where you have an epileptic student who might need a plan, an emergency plan, potentially a medication that's given in a certain way. Those are things. Those are things that you may be doing, but you are that subject area expert in your school and in your community. You possess critical knowledge, obviously, and you understand how these conditions, not everybody understands ADHD as an alertness issue, right? Like that is a issue where, people will say that you are not paying attention, but that's actually a condition of cognitive alertness, right? So you can't hone in and focus on things. So there's things that you can draw on and add to a conversation that no one else in the IEP team can provide. You really pay a lot of, you have a lot of work in medications, understanding them, administering them, educating staff on potential side effects of medications, especially if a child starts a new medication. We have a lot of parents out there who are like, I'm just going to see if the school notices. I never recommend that. I think when a child starts a new medication, you want to make sure that you are aware of what that medication is so that you can be looking and asking others to look to see if there are side effects. You also provide screenings. Which is part of the multi-tiered system of support. And you also are a valuable IEP or 504 member. So again, you can do assessment, diagnosis, outcome identification, planning, intervention, implementation, collaboration with other medical personnel. If I'm a special ed director and I have a complex case or there's a medical condition and there's an outside physician, I'd probably have you work with that person a lot of the times so that I know that you guys are speaking the same language because obviously I don't have the training and background that you do. Um, there are some similarities to nursing roles in other settings, except it's very different in a school too, because you're part of a larger community and people are going to rely on you for just more. I mean, the adults are going to rely on you. The kids are, you're probably all experiencing this. The adult might come to you and say, listen, I'm having this health condition. Can you give me some advice? So you are like kind of the health professional in that community. And really is an important part of a school community. Um, and definitely hearing and vision screenings. I think sometimes those are part of that MTSS broader picture. Every SAU has a different culture when it comes to supporting kids through nursing services. I think you all know that. Some SAUs are very well resourced. They have multiple nurses in the SAU. They have them in every school. Sometimes you're the person working to support 10 schools and no one has enough time. And so that's important to understand. Obviously, there's a nursing shortage. There's a shortage of many professionals in related services, including speech therapists, OT, school psychology, speech therapists, nurses, all very, very on high demand. So it's best practice for you to be engaged in your school community, participating in your multi-tiered systems of support, observing in multiple environments, providing staff support. So if staff need training on how to intervene, again, looking at symptomatology, looking at reactions to things, that's really where you uh, get to be the expert in the room. And it's important. I don't want school nurses to be doing duties like watching people eat in the cafeteria, but it's also important for you to go through to multiple environments because you're going to see kids, who maybe have challenges in the classroom but shine at lunch or recess or in social contexts. So it's important for you to see the whole student and where they are and how they perform in terms of being able to lend your expertise to your school. So when you're in an SAU, maybe say you're new to an SAU or you have a change in administration, that happens too, right? Like when you have a change of expectations based on the revolving door of superintendents or special ed directors that you have, it's really most critical for you to have a clear understanding of the chain of command. Are you going to your principal first and then your principal is going to the special education director? Are you reporting right to your special education director. Everyone will have a little bit of a different, unique way of doing that, but it's really important for you to have a clear understanding of the chain of communication, especially in emergency. When you have a child with a a critical life, potential life-altering disability or medical condition, you want to know what the routine is going to be if something should occur with that child. You want to know who needs to be notified. You want to have that plan in writing, and you want to make sure that it's clear to everyone who gets informed when and how you have to document that. Again, those aren't things we prescribe to you, but those are things you want to be knowing about. Um, you definitely want to clarify your roles for special education students in general, special populations. You know, sometimes some of the students in special education will take a great deal of your time, and you may feel I'm really kind of not serving the general population because I'm mostly serving this very highly medically fragile person. Those are conversations that you should have with your administration and just and there is resource issues across our state. As we know, nurses are in great demand, but it is important for you to have some understanding of how you fit into a building culture. And you want to review the documentation and types of documentation that your school provides or policies around what kind of documentation. And then if you feel like there's an additional type of documentation, you want to make sure that that is captured because again, when you go to an IEP meeting, IEP meetings ask you to collect and inform regarding certain data around performance of a kid, so a child. So it could be that you are, seeing a kid or child every 3 hours in the school day, and you want to be taking that data and capturing it so that you can report that to the IEP team. Is some children, I know this is going to seem very strange to you, and I'm sorry my light is so weird, but some children go to the nurse for comfort and support, and so they leave the classroom to go and get comforted by the nurse. And so those are important things for the team to know so that you can say it's not a great strategy for you to leave instruction to get support. How can we get you the support? So that's the kind of data you want to be tracking for all these kids. And if your school doesn't have a good way of tracking, then you should make some recommendations about that and then work with your administration to see, how they want to use that data. So your participation in the IEP, you're really looking at for IEP. Now, this is not 504. IEP is really what is the medical need that's impeding the child accessing their free appropriate public education, which is called FAPE. What is that? What is the impediment there to them accessing? That's what the IEP is all about. Medical needs that impact the child's learning should be addressed through the IEP. Um, Only you can provide a nursing service. No one else can. And so you want to be really careful when you put yourself as the person responsible for a service or an IEP team does. Um, School health service that do not require a nurse should be documented in section 7 as nursing services. So I'm going to go through these. There's two main sections of the IEP that you'll be written in. You are not going to write goals. For instance, you're not going to write a goal that says, um, Johnny's going to get rid of their asthma by 2026. So those kinds of goals are not helpful. What could be helpful, however, is a goal that says Johnny should advocate for his medical needs by asking to go to the nurse when he's feeling dizzy. So those are kind of executive skills that support health that could be written into a goal, but that's not the goal that you would be responsible for, even though you're informing it, because the only goal you can be responsible for is a nursing service. So that might be clearing a trach tube, that could be administering medications, that could be checking a gastric mechanism, whatever it is, that is your role. So the two sections of the IP that are most important for you to understand are section 6, which is supplementary aids, services, and accommodations. These are not services, they're accommodations. So an accommodation might be that you're going to see the nurse to access medication when blood sugar is low or when alerted. Those are accommodations. So again, they're not goals that you're going to be monitoring. Well, you're going to be monitoring that. I shouldn't say that. But access to a school nurse for whatever it is, this is an accommodation and modification. A service will be in section 7. And I put this down here. This is an example that I have for my main care documentation. So you have two areas on the IEP, the special education services and the related services, and nursing is a related service. The only person responsible for nursing service can be a nurse. No one else can be responsible. And then you can see 5 times 5 minutes a week. This is likely like a medical administration or something along those lines. Um, Special education services can only be provided by a special education teacher. We do have speech language as a standalone service in Maine, and consultation could be a service that is provided by a nurse here. Typically, it would be on the related service. It's not wrong to put consultation nursing service on the related service page, and it's not wrong to put it on the consultation page. So that can be either. And then here is something that I bet none of you get spoken to about, or very few of you. Starting in age 16 or the ninth grade, whichever comes first, the biggest goal of the IEP is the transition from to life after school is completed. And this plan focuses on education, training, and employment. But in my feeling, the nursing services or health conditions of these children are going to have to be independently approached for each child as they transition out of a life where there's a school nurse in their building every day. So, starting at this time, we have to really be thinking about what kinds of advocacy or health supports do these children need after they leave school. Someone who's medically complicated might have a lot of advocacy around this area, but somebody who's not medically complicated, such as someone who just has an IEP and also has diabetes, they may need training and support on independence from that. And so it's one of the things that we're pushing a lot more in Maine because it is about independence after you leave school. The whole IEP is about getting you to the life of your dreams after you leave school. And part of that is being independent and responsible for advocacy of your own medical and health needs as you age. Children should be attending their IEP meetings at this point. I had children attending IEP meetings since grade school because I thought children aren't going to know what their goals are if no one tells them what they are. And it's very hard to work on goals that you don't understand or don't have any individual connection to. So keep that in mind. I'm trying to look at the time. Yeah, that's it. I think that's it. So this is my contact information. This is Emily Poland, who is the school nurse. Um, And I did that really quickly. So I want to open it up. I'm going to stop sharing. Um, I want to open this up, the conversation up, if there's anything that anybody has a specific question. But I hope that that is what you need, especially how all these laws work and how you need to get some supports through that work. So, are there any questions? Maybe you all know everything already.
Thank you so much for that informative presentation, Erin. That was excellent.
Yeah, I mean, it's what I would want to know. I think like every time you go into a new school situation or you get new administration, you're at ground zero. You have to start over. But that communication, understanding the culture, how you fit in the culture, what the expectations are of you as in your role is really, really critical. Because it's happened to me where I've had 4 new superintendents in 4 years in an SAU where I was working. And so every single one of them, it was like, you're starting over from scratch. What is your expectation? Some of them were very knowledgeable about special education and they would support my decision making around it. And some of them were like, I don't care about special education. I hate that, and I'm not going to talk to you about it. So it really can disrupt you if, for instance, you get a new principal or a new special ed director, those things. So it's really important to be clear and communicate with people what their expectations are and how they want to handle things.
Erin, just to follow that point, this is Alyssa Goodwin. Even when we're sort of thinking about, sort of different administrative levels at like the district level, I live in a community where I would say the culture between the schools is also really different. And so just even navigating as I'm a school advisor, the school physician for my local community, and just sort of navigating different relationships with the nurses are all amazing, but
Yeah.
how they're involved or included in discussion and planning, I'm often surprised at how infrequently school nurses are included in even 504s, and certainly IEPs. So I think just I
Mhm.
now attend both IEPs and 504s with my patients in my practice setting, and it's been pretty amazing. But I think just it's okay to be a little nudgy about that, and invite ourselves to the table. So and then I see a question from Kelly. Um, just a follow-up question to you said earlier that a student can have both an IEP and a 504. And I would agree with what I'm reading here from Kelly, that we've always been told that an IEP supersedes the 504 and that they would just have an IHP as part of their IEP. So can you just say a little bit more about that
Yeah.
confusion we all have?
Yeah, there's no superseding. If anything, ADA 504 is above IDEA. So it doesn't that the IEP supersedes. IEP is a instructional plan. There's specially designed instruction to it. 504 is a health accommodation plan. So it is possible for you to say, um, yeah, I have an individual health plan, and these are the things, and that would be attached as an accommodation. But some parents want to make sure that those health conditions are protected under the Office of Civil Rights, not the Office of Department of Education, right? So that's the difference is that really the 504 also carries through after school and into college. And it's important for children to have those rights under their protection. That being said, I don't want you to go back and tell all your special directors that I told them, but you can have both. Sometimes parents will want both because of those ADA accommodations. It doesn't really matter as long as the accommodations are being followed. But certainly they're just different plans. So one is a general education initiative, one is a special education initiative. So, and the 504, like I said, it has a little bit more teeth in it in terms of if people aren't following the plan, parents and students have the right to sue them for damages. So it's different than IDEA, and it's a civil rights law, and it is, but again, you don't necessarily have to have both. You can have both. They are not mutually exclusive. They're two different plans. If you have a health plan and you're calling it a 504 plan, you would do the same thing that you would do if you have an IEP, which is um, refer to it in the supplementary aids and section and say, this child has a health plan and make sure that you know it. And then the other thing is, making sure that the people who need to know about that health plan know about that health plan. Now, there is FERPA and HIPAA are around records. They're around records and private information. And I always tell people, like, just imagine this was your kid and we had all of this knowledge and information and psychological assessment and all this. Who would you want reading your kid? Who would you want to say you have to know this information? It's a good way to think about, what kinds of information you're giving to who. But accommodations is one of that pieces of information that most people should have, especially around a health condition. You want most people to know that there could be a deathly allergic reaction that could happen at any time in a school setting. The more people that know that, the more people can react quickly if something happens and they know how to react. So people often say to me, I can't discuss this with the person who works in the cafeteria. And I'm like, that person really needs to know if there's a food allergy. So, because that person is going to be serving food to this child potentially or in the room where the child is. So, I just like for people to, records are complex. HIPAA is too. I always want to be in I have been in schools where I've heard people in teacher lounges talking about private things about kids, and I want to put up a sign that says, this isn't your right to talk about private information with your buddy about what you think about someone's special education plan or their health plan or their health condition. These are private pieces of information and they're on a need to know basis. So but yeah, I kind of exacerbated that. I kind of stretched that out. But no, you can have for both. Also not necessary to have both. But like I said, parents who are in the know about ADA will be wanting to have that protection because it extends beyond school, especially you're going to want to have that information if you're going to secondary college or training or CTE or things like that. You're going to want to make sure that those are in place at the transition when a child's leaving school.
Thank you. I think it gets really confusing. And I think everyone's afraid of just, getting in trouble for doing or saying something that's not, allowable. But I like the way you kind of frame that in terms of, the team that really needs to know to implement the plan really are the folks that should be involved. And then another question, just looking, I think, for discussion and clarification, saying, I don't utilize the CUME file in my practice. Can folks share or discuss how the nurse would or should use this in their practice?
Well, it's good that your health records aren't stored with your CUME file. First of all, I just want to say, if you don't know what a CUME file is or you've never seen it, that's probably a good thing. A cumulative file is any educational record not related to health or special education status. So it could be attendance, it could be discipline, it could be inoculation. Oh no, they might have that in a CUME file. No, they don't have that. They have that in the health file. Thank you. So it could be certain things, but they may have like a piece of paper there that says, yeah, everybody's all set to come to school because we know in Maine you have to be inoculated to go to school. So, there's certain indicators and there's certain levels of permission of people who can look at the CUME file. But the CUME file is a record that parents can review. They have access to it, and they can also make an argument that something is not, they don't, lots of times parents have potential disagreement with how a behavioral incident or a disciplinary incident is written or talked about. If parents ask for discipline records and there's another child's name in that record, that information has to be redacted. But that's a CUME file. You probably can have a student SIS in your system that has most of the data that you would ever need about a kid, including attendance and grades and all kinds of pertinent information. You may, if you're lucky, have an electronic health record system, which is coming. It is coming. We're mostly going in that direction. And all these systems can work to support really good communication in schools.
So it sounds like largely in terms of school nursing, there wouldn't be a lot of documenting or health information shared that there. Would something like a food allergy or, sort of an emergency medical situation be there, or would that just be shared with those who are sort of in the need to know?
Yeah, I think those would be shared probably in your student SIS. You probably have a red flag on there that says there's an allergy. You need to know these are the accommodations. There'd be an IEP flag if you have a system like that. And again, not everyone has access to the CUME file, so it's not a great place to make that information available. They might be sticking the accommodations in there. I don't know. Every school is different in terms of what they have for that. There might be like a district policy about being in photographs or being on social media, your image on social media, or opt out things. Those are the kinds of things that are in that CUME file. And, you never want to take a picture of a child in school unless you know you have permission to do it. But that would be where that information is stored, not health information.
So, and then following up about FERPA and the parents' rights to see information in the school records, with the exception of the personal notes. Can you give an example of what like the personal records or personal notes might be? This Kristen who's asking the question says she's imagining like sticky notes on a notepad. So the electronic version of that, or how we would document that so that it's clear that it's not part of the school records.
Yeah, that's a really good question. Personal records are basically memory aids. So anything that you're writing to remember something about a child, that's just your own personal memory aid and not really a formal document. So a formal document by be writing up a health incident report where somebody got a bee sting and you administered something, and that would be a health report. That's an official document. It's written in a formal way. Your personal notes are really just memory aids. So yeah, it could be a sticky note. I would not do sticky notes because those things will disappear and someone will find them, and then you'll be sad because then they'll be like, oh, now I have this information. But yeah, it's definitely in education, in special education. Things like running records, notes on performance that aren't formal are personal documentation. It's a little bit different in the teaching world, but in your world, I might say I'm gonna write down. I don't have in my school, we don't have a formal call log policy. So, but I'm gonna keep notes of my conversation with this parent and the date and time because this parent says I never call her, and I'm just gonna just keep track of my personal notes that I've called, and this is kind of what went down. But there may be informal language or things that you use in there that you don't want the world to see. Um, and that would be pretty much private in a place like if there was a lawsuit, they would have some restriction on whether or not they could access your personal notes.
So would it make sense? And I guess it depends on each school system in terms of electronic or paper. But I'm imagining like writing them not in like a sequential order of like, encounter notes or incidents, or if labeling like personal record or something, I think that's what I'm sort of reading in
You
this
would have
question
like
is,
a separate area of storage for sure.
yep, okay.
You wouldn't want this to be stored in an area with other formal records. You'd want this in your own filing cabinet or on your own desk or however. I mean, it doesn't have to be formal. It could be like, even your desk planner. I remember we used to have those calendar planners back when I had an office and, things like that. Those are personal notes. You don't want to, you want to keep them separate from formal records. And know that they're your personal notes and they're used for your personal use. So they're not really, but again, sometimes, again, if you don't have a formal call log system, and I always suggest people do have a formal call log system, but if you don't and you want to keep track of what you're saying to who and maybe summarizing a conversation you had with a pediatrician, but you want to just write down your notes before you type it up in a more formal thing because maybe that doctor says something to you that you don't want in a formal record. Those are the kinds of things that are personal in nature, that are your own memory aid, and they're for your use. And they don't, and you can sometimes transcribe them into something more formal and keep them formal, but they're really your own personal notes, and therefore they are exempt from those records pulls that sometimes happen when there's a litigation happening.
Thanks, that's super helpful. I don't see any other questions in the chat. So I don't know if anybody else wants to be brave enough to come off mute and ask a question or has something burning on their mind.
And if you don't have a question right now, but you think of one as soon as you log off, just email me and we'll get it answered.
We'll get you the PowerPoint for this, and sometimes you'll think of something 10 days from now and be like, oh, I should ask that. You have my email, and I'm really responsive to email, especially when it's a practitioner, because you guys are the front line and we need to support you how we can. So,
I have a question.
okay, Melinda.
I was typing away, but I often find that first, nurses are not invited or even offered. So I actually asked them to invite me to all the 504s, but I've not done that with IEPs. So that's one question. And I wonder if we should do that. Here's the other question is I often find that psychological evals or other evaluations are done through the IEP process, and it is not shared with the nurse, and it often has information that I should be aware of, like to put on as a red flag, right? And I had the process going for a while with the other psychologists. And I asked about it and she wasn't really sure the answer. And I guess I would like to know that answer. Is that something that we should be receiving, like the diagnosis list, or is this something that we are not privy to because it's an IEP?
That's a really good question. First, I want to know, just as someone who is a special ed teacher in a school, one of the biggest barriers to inviting a school nurse to an IEP meeting is remembering and the amount of, so unless you have a child with a really glaring health issue, you may neglect to remember to include your school nurse. There's a lot of coordination that has to happen with scheduling, and obviously you're very important to this process. There should be consultation if there is a health issue, obviously, but sometimes that neglect happens because of the nature of trying to put a 5P team together. I think it is actually like a little bit easier now that we all have access to Zoom and we don't have to like physically show up in places. But in terms of the psychological evaluation, it is not something that is typically shared widely. It is shared with the special ed director, the special education teacher, and the parent. That information often has very sensitive information in it that is kind of like on a HIPAA level, need to know basis, just as you may have medical documentation that the special ed teacher really can't know. There may be and when there's a psychological evaluation that occurs, what happens is the school psychologist reaches out to the parent and talks about it. I've also had parents who have said, I want you to take that out of the school, the psych eval, because I don't want to have that information in there. So it's a very sensitive topic. That being said, if you attend an IEP meeting, you get the meat of the information of what that psychological evaluation has in it, and they should be writing the results in the IEP. There's no reason why you can't read the IEP and it would have that information in there, at least the summative information. So, that would be what I would say about the psychological eval. I mean, to not every student, even with a medical need, will need you to attend an IEP meeting
Right.
because it's just not necessary. So it's really important for you to understand who on your caseload, who you're seeing with, and then meeting with those special ed teachers and talking about, listen, I'd really like to come and hear the whole picture here because it's helpful for me to know how they're doing in class and on the playground and all these things because I'm part of this team. So I think, 504s makes a lot of sense, and IEPs also makes a lot of sense. And I think sometimes, we have, as you know, sometimes we have staffing shortages, and I always think people are doing the best they can, but communication is critical around medical issues for children, and especially the intersectionality of health and disability, obviously. So I think that you can get a lot of information by attending the IEP meeting, and it is not the psych eval is not widely shared, even with the IEP team. Like people don't get copies of the evaluation at the IEP team. They're really getting the big picture themes because some of those things, the nature of them are, however, if the nature of those things that are serious have health implications, some of those things that might be, like a violent sexual attack or whatever that might have a health implication, you will need to know that. You'll
Yeah.
need to know those really, really hard things to talk about because there might be a health situation. So it just depends. But no,
Yeah.
typically you're not going to get that eval. It's just something that we kind of keep under wraps. Not everybody sees those.
Okay, thank you. I mean, it's just hard sometimes because you get parents that say, well, it was in the IEP to me. And I'm like, well, I didn't go to the IEP and I didn't know that they had that specific diagnosis. And then my next, question to them is, would you like me to add that as a red flag? So I've done more of that with ADHD just because, I think teachers want to know those certain things because they would arrange the room differently and, make further accommodations for that child. But so I tend to ask the parents after that what they would like me to do. But I often get that, question like, how come you don't know? I'm like, well,
Yeah. Yeah. It's, it's the biggest challenge in a school setting is to make
yeah,
sure that people who need the information have the information.
at the table.
Yep.
Yes.
Yeah, it's very hard. And it sounds like you're a massively hardcore advocate for kids, which is what you should be and what we
Yes.
want all of our nurses to be. So you want to be helpful, and that's why you're advocating for that. And I think you should do that. First, keep doing
Yeah.
that because again, it's helpful. It's helpful for
Yes.
parents to know that they have a health advocate at school
Right.
because sometimes a special education teacher can't be that health advocate or isn't that health advocate.
Yeah. It's just nice to know for me in the back of my head, that they have these things. If they come in, like, it could be other situations or, they have anxiety or whatever it may be, it's just very helpful. And it might trigger me to do some things differently, I guess is why I think about it often. Yeah, I guess sometimes I'm more involved than I should be, but I love kids.
Yeah.
I just want them to be successful. Isn't that our goal, right?
Yeah,
So
it
thank you.
is. Yeah, no worries. I mean, it is. I mean, I'm the same way. I'm like that pesky person that's going to keep asking the question.
I
Everyone's
know.
going to be like,
I
oh my
do
God,
too.
stop. And we do it for a reason and we care
Or I
about
show
kids.
up and I wasn't really invited, but I have
Yeah.
that student on my caseload and I see that student often. So teachers will say, well, how come you weren't invited? And I said, I am now.
Yeah. Yeah.
So thank you. It was
Yeah.
a very great meeting.
All right. In the interest of time, I think we'll wrap up for today. But again, just email me if you have any other questions. So thank you again, Erin. I will send you all a link for your evaluation by Thursday morning to complete, and you will receive your certificates within 10 days. If you don't receive the link to complete the evaluation, please reach out to me because there are a couple people on here that just states iPhone as your name. If that's you and you didn't get a chance to put your name in the chat, please send me an email. Also, please join us after the new year on January 7th for Keep Calm and Co-Regulate, a trauma-informed response to behaviors by Dr. Gretchen Pianka. So thank you again, Erin, for your presentation.
Yeah.
Thank you, Alyssa, for facilitating questions. And thank you, everyone, for being here. Happy holidays to you all and see you in January.
Thanks, everyone. Bye.
Bye.
Thanks.